On October 25th, I had a round of surgery at the Jewish General Hospital, which is one of the McGill teaching hospitals. And then another round, or 30 rounds of radiation was suggested as part of the protocol. At that point in time, decided to pursue other alternatives and see if there were other alternatives, and there were at the University of Pittsburgh. They offered a surgical alternative, which seemed like a much better option than the radiation. And that's what I elected to do. Well, one of the things that interested me about the surgery in Pittsburgh was the fact that the recuperation time was going to be much faster. It was going to be approximately 7 weeks of recuperation time. Psychologically, I know exactly where I stood with the cancer. They were going to do all kinds of biopsies, and they would have known exactly the extent of the cancer, which they did not know in Montreal because they couldn't go into the brain. So I inquired as to whether triAcess would cover this treatment, and they did. They responded very quickly. And within a week, I think everything was set up at the University of Pittsburgh. The triAcess policy was a phenomenal investment. The cost of surgery in Pittsburgh after triAcess negotiated with the university was $250,000 US. The total time to arrange all this was a matter of about a week, not much more than that. Actually, there was a longer period of time waiting for the surgeon to be available. He was traveling on vacation for 2 weeks. So otherwise it would have been done, I think, within the week. The initial procedure was 5.5 hours. That occurred on December 20th. They took many, many biopsies, including the lining of the brain called the dura. They actually went that far. All the surgery was done endoscopically through the nose, and I was out of the hospital within a matter of 48 hours. So I had 5.5 hours extensive neurosurgery, was out of the hospital within 2 days, and then had to wait for the results. The results occurred about a week later, or were presented to me about a week later. They were all negative. Unfortunately, I had a complication from the surgery and had to be reoperated on January 1st. The care was nothing short of sensational. I mean, just from the time I had my initial surgery, the protocol was to have the surgery, discharge me from the hospital relatively quickly, wait to see if there were any complications because there was a 10% probability that a complication would occur. I did end up with a complication which required another round of surgery. In the interim, triAcess arranged for me to come home by limousine because I was unable to fly. The day I was supposed to go home by limousine, I had to be reoperated on. I called triAcess. They took care of all the issues with the hospital. Everything was arranged, and it went really smoothly. And as a matter of fact, that call was made on January 1st when most people were on holiday, and yet I was able to reach somebody from triAcess, and they made the necessary arrangements with the hospital, and it was really seamless. It was really unbelievable. I was actually back at work within a matter of, it was actually faster than 7 weeks. I was back at work mid-January, so I was effectively out of work for about 4 weeks, and I was back skiing within 7 weeks. There really wasn't a viable alternative to what the U.S. was doing. Canada suggested the first round of surgery, which I did do, and then they requested that I do 30 rounds of radiation, which was a very, very difficult alternative. The radiation would have subjected me to incredible fatigue, loss of appetite, all kinds of other issues. I would have been at work probably for about 6 months with the radiation. Well, Manette was the one who convinced me to buy the policy. She said it was relatively inexpensive. It was, as a matter of fact, it was very inexpensive. And she said it allowed you tremendous flexibility, and you'd have up to about $3 million US to spend in your lifetime. And I purchased the policy February '04, and about 9 months later, I was actually utilizing the policy. And as I said, my first experience with triAcess cost the company about $250,000 US. As a matter of fact, they're still covering all follow-up visits and airfare to the University of Pittsburgh. First of all, with regards to triAcess, there are many, many procedures offered in the U.S. that are not offered in Canada. You know, the Canadian medical system is good, but it has its limitations. The U.S., because of the amount of dollars people are spending, allows them the luxury of pursuing modern research and and acquiring all the modern equipment necessary. So there are much better alternatives available in the U.S. But the cost is exorbitant. I mean, if I were to foot this bill myself, or if I would have footed this bill myself, it would have been probably close to $400,000 or $500,000. The triAcess policy is pennies in comparison, and it was extremely effective. It was headache-free. I mean, it worked absolutely flawlessly. And Monette was the one who, as I said, convinced me to buy the policy. She was relentless and tenacious about it, and because of that, I had a much better success rate with my cancer. I've been cancer-free for 4+ years. I haven't needed any further treatment, and as I said, the policy was literally pennies.